Thank you very much for being here today. Before I get started with my remarks about the coronavirus, I just have an announcement. I've appointed John Dempsey to be the new commissioner of the Boston Fire Department. Commissioner Dempsey is a 35-year veteran of the Boston Fire Department. He has risen through the ranks of the leadership. In March, I appointed him the interim commissioner. Shortly after that, the coronavirus outbreak began here in the city of Boston. He's approached this challenge with the same professionalism and decisiveness he's shown throughout his long career. Throughout this crisis, Commissioner Dempsey has succeeded in serving the people of Boston with the excellence they've come to expect from the Boston Fire Department. He's implemented safety protocols, cleanings, and PPE at all of our stations citywide. He's kept our firefighters safe and the department fully operational. He's done an outstanding job under the challenges and circumstances, and I'm proud to make his appointment permanent. I've asked the city to help me in welcoming and congratulating our new fire commissioner, Jack Dempsey. I'd like to ask the commissioner to say a few words.
Thank you, Mayor Walsh. This is an unbelievable honor to serve as commissioner of the best fire department in the world, as far as I'm concerned. I've noticed a lot of people over the years that through my career who have been great leaders, and I plan to follow in their footsteps, maybe even create a few footsteps of my own in the service of the city and the department. So I want to just say I'm very proud of the way the Boston Fire Department, Police Department, and EMS people have conducted themselves through this crisis. They've done a great job, and makes me proud to be a part of that. Thank you.
Thank you very much, Commissioner. And I also want to just take a moment to congratulate another member of our Boston first responder family. Officer Omar Borges, an 18-year veteran of the Boston Police Department, was released from Beth Israel Hospital today after spending several weeks in the hospital battling COVID-19. We wish him well as he returns home to his family, and we thank him for his service to our city. I think it's important to acknowledge some of the celebrations that are happening during this time as well. An update on the numbers as of yesterday. The total number of cases in Massachusetts was up to 46,023. That's a 3,079 increase from the day before, with 2,360 deaths. And that was an increase of 178 from the day before. In Boston, as of yesterday, we had 6,958 cases, up by 398. That's the largest single-day increase, not counting the day before, which some new numbers were added in that were missed in the previous counts. We had 232 deaths in total, and we had 11 yesterday. These are certainly big increases, and we're approaching the peak of the coronavirus, but we're not there yet. I'd like to just pass along my condolences to the families of lost family members during this virus, and to the families that are struggling with their loved ones in the hospitals right now. Let you know that the city, you're in our thoughts and prayers here in the city of Boston. We do know that the measures that we're taking in Boston are working. These numbers would be much higher if we had not taken very strong steps. And if the folks in the communities haven't been social distancing, physical distancing, staying at home, and doing everything that they have been for the last, say, 6 or 8 weeks here. The closure and the social distancing rules have made a big difference. Our planning for our medical capacity and equipment has also made a big difference. The efforts by the individual Bostonians have made a big difference. Every single time you stay in, you keep your distance from others, you cover your face, washing your hands, you've helped protect not only yourself but your family and other people here in the city. We need you to keep it up, and I'm asking you to keep it up. We cannot get complacent. We need to treat every single day like the most important day in the outbreak so far, because it is. The city is continuing to use every resource we have to slow the spread of the virus, conserve our medical resources, and allow healthcare workers to do life-saving work. I'd like to be clear, there is no economic recovery without public health. We are developing public health criteria for all stages of recovery. But to meet any meaningful criteria, we need more testing. Testing helps us understand how many people are infected and in what areas. Testing shows us how this virus behaves and what it means for us in the long term. Testing allows us to use our medical resources more efficiently. Ultimately, we're going to need strong federal commitment to testing. But but we've come a long way already, expanding testing here in the city. Through our Boston Resiliency Fund, we have dedicated over $760,000 to expand COVID-19 testing in the city at 9 community health centers in East Boston, Dorchester, Mattapan, and Roxbury. We've granted an additional $270,000 for telehealth services and equipment at those community health centers as well. This connects testing to safe treatment options at home. We also started sharing data on testing at a neighborhood level. New reports will include the number of people tested, the positive testing rates for each of our neighborhoods. These reports will be released on Fridays. We now have 15 testing sites up and running across the city of Boston. That includes 10 operated by community health centers and 5 operated by hospitals. The East Boston Neighborhood Health Center, Whittier Street Health Center, the Dimmick Center, Uppins Corner Health Center, Bowden Street Health Center, Dot House Health, Harvard Street Neighborhood Health Center, Corbin Square Health Center, Mattapan Community Health Center, Brigham and Women's Faulkner Community Physicians at High Park, Mass General Hospital, Tufts Medical Center, St. Elizabeth's Medical Center, Brigham and Women's, and Kearney Hospital. We got many of these sites up and running in the last week or two. Since that time, we have seen major increases in the number of testing. Last week alone, we had over 30% increase in the amount of testing happening across the city. We focused our efforts on the hardest hitting areas. For example, last week in Hyde Park has had a 57% increase in testing. Mattapan has had a 35% increase in testing. And the hardest hit parts of Dorchester have had a 37% increase in testing. We're going to keep working with our partners to increase testing throughout our neighborhoods, focusing especially on areas that need the most attention. We also created a map to make it easier to contact a testing site near you. It is available at boston.gov/coronavirus and at bphc.org. It will be updating on new sites as they come online. It's important to call ahead to be pre-screened and scheduled for an appointment. We're asking people, do not show up without an appointment. You will not be tested. Our goal is for every community health center to provide testing for residents in the near future. We're also going to keep doing targeted outreach to our immigrant communities. We're hearing that some immigrants may be afraid to get tested. The fear is made worse by the president's rhetoric on immigration this week. I want to speak directly to the Boston's immigrant community. It is safe to get tested. Testing is free, and you will not be asked about your immigration status. We are working hard to get the message out there. It's important for us that we test all of our residents in the city of Boston, our immigrants and our long-term residents here. All of our city's COVID information is available in all the top 11 languages spoken in Boston. Our text alert system is also available in different languages. We're doing robocalls to seniors in different languages. Our neighborhood liaisons are doing targeted outreach using sound trucks, flyering local businesses, and distributing packets of useful information. And we're working with ethnic media to make sure our immigrant communities have the information they need. And we also have other elected officials, our city council, members of our state delegation who are also helping us get this information out. On one other note, I want to remind both landlords and tenants that immigration status does not affect tenant rights. We've heard concerns about this issue, given the financial challenges that so many are facing. If you're a tenant who feels threatened, stay home and call 311. There are laws in place to protect you. And as a matter of fact, if anyone feels threatened living in an apartment, call 311. The laws are there to protect everyone. In Boston, we've banned all eviction proceedings until this crisis is over. The state followed suit earlier this week. Our Office of Fair Housing can provide advice and support. And to all of our immigrant residents, the Mayor's Office of Immigrant Advancement is here to help you during this time. Boston stands united in support of our immigrant neighbors, many of whom are on the frontline workers in healthcare, food, and essential industries. I talked about it last Wednesday, about the number of immigrants that we have working in our workforce, whether it's in grocery stores or in operating rooms. And the numbers are 35% and higher than that. So we're asking everyone to respect each other. I also want to talk about our work serving the homeless population during this time. We've been conducting widespread testing of our homeless population. As of yesterday, 1,340 people have been tested. About a third of our homeless individuals have tested positive. We've added over 900 new beds across the city to reduce the density in our shelters and to treat homeless individuals who are impacted by the COVID-19 outbreak. We continue to work every day to support our homeless population and the staff who serve them with shelter, with care, and with testing. We continue to talk to our partners in government and nonprofit community about the resources we need moving forward. It's our goal to test everyone who uses emergency shelters in Boston. Today, we are one step closer to reaching that goal. The City of Boston has secured 1,000 additional tests, which will allow us to test all guests in our shelter system and some staff as well. That means we'll have universal testing for our homeless population. The tests are being donated by a Boston company called Origin. The tests will be done over the next 2 weeks. The efforts will be led by our partners, Healthcare for the Homeless, in coordination with the Boston Public Health Commission, St. Francis House, and Pine Street Inn. Individuals who test positive will go get the care and support they need to recover. Individuals who test negative will be placed in designated areas to allow better physical distancing and help us slow the spread. I also have another update for our small businesses. Throughout this crisis, we've worked with our local businesses to give them the flexibility they need to continue serving customers. We've allowed all restaurants to offer takeout. We're helping them get their operations online if they weren't online already. We're allowing some residents to include beer and wine sales with food takeout and delivery orders. We're allowing essential businesses to provide free paper and plastic bags. We've created a directory of business that remains open. And we've created a 5-minute pickup zone in front of restaurants for takeout and delivery. Any of all that information I just passed along, if you haven't received it or don't know about it, we're asking you to reach out to our Small Business Development Office. You can call 311, and we can help you with the resources. Today, we're taking another step to help small businesses during the public health emergency. We are now allowing restaurants to sell grocery items, including produce, paper, products, and more. It was a request that we heard both from restaurants and customers. It may cut down on the essential trips outside the home as well. If restaurants want to start selling groceries, they must follow strict safety guidelines. They will also need to follow clear guidelines for packaging and labeling food. Restaurants will still be required to limit occupancy to 10 people at any given time. They will have to maintain physical distancing with at least 6 feet between all staff and customers. To get started, restaurants should submit a health and safety operations plan to the licensing board. For more information, go to boston.gov/coronavirus. I also want to remind shoppers that you have a responsibility whenever you are visiting a business. When you're in a store, I want you to be aware of your surroundings. Do not go in groups. Do not take up the whole aisle. There's no socializing going on. Get your shopping done quickly and leave. And I want you to be respectful and gracious to the grocery store workers because they are our frontline workers. They're working hard in these difficult times. You should be wearing face masks and coverings when you're in grocery stores or in any store. This will help protect yourself, your fellow shopper, and the grocery store workers. And when you're done using them, we're asking you to bring them back home and wash them or dispose of them properly. Unfortunately, as I said last week, we heard that from grocery store staff, they're dealing with used gloves and masks being thrown on the ground in parking lots. We don't want them to have to pick them up and pick up your trash. We're asking people to do it yourself. Take it home with you. Dispose of it properly. Everyone's stressed and everyone's on edge at this point. Remember that your actions affect other people, and we're asking people to do the respectful thing. Set a good example, and it's making a difference. Just to go back real quickly to the restaurant guidelines today, I also want to thank the City of Somerville. I want to thank Mayor Curtatone and his team for helping us. They did this before we did, and they helped us with the guidelines and how they implemented it. So thank you to Somerville for your help there. And it shows that it's important for us to continue to work together as a state, as cities and towns all across Massachusetts, all across this country, to move forward. We should all be grateful for the people supporting our efforts here in Boston. It's not enough for me just to list them all. I want them to know and see that we appreciate their work. Today I want to focus on Boston's Public Health Commission. This is a city agency that is central to our response here in Boston. Their work is far-reaching, and their work is on behalf of every single resident in the city of Boston. They run our EMS system and always answer the call for help. Our EMTs and paramedics respond to about 300 calls per day. The majority of these calls require EMS members to wear full PPE gear to protect their safety and the safety of their patients. Also, our street workers outreaches and our shelter workers caring for our homeless population. They run the recovery programs for people battling substance abuse during this pandemic. They're in constant contact with every hospital and healthcare center. They keep track of the data on cases and share it with me because the people of Boston deserve that type of care every single day. Our Boston Public Health Care nurses continue to do contract tracing, identifying and offering support to the people who may have been exposed to a confirmed case of COVID-19. The Boston Public Health Commission was key to getting the Boston Hopefield Medical Center up and running. That was a historic accomplishment. And together with our partners, they've treated over 360 patients so far. The Boston Public Health Commission staff are helping care for our most vulnerable residents. I want to thank all of the staff, regardless of your role at the Boston Public Health Commission, for your great work. Their mission is achieving health equity. Since the very beginning of this crisis, they've identified the communities that need extra outreach, and they're working to ramp up testing in all of our neighborhoods. To the interim director, Rita Nieves, and Chief of Health Human Services, Marty Martinez, and all the talented, hardworking staff members on your teams, I want to say thank you for your great work. I'm deeply grateful for our city, for the work that's happening in our city. You are saving lives every day. You're an example of excellence we strive for every day here in the city of Boston. And I just want to take one last minute before I go into questions. I want to thank the residents of Boston as well. This is a very challenging time. As I've been saying all along, we're finishing the 7th week, for the most part, of the lockdown here in the city of Boston. It seems like it's been going on for a lot more than 7 weeks. And for the foreseeable future, we're going to be doing the same thing to stop the spread of the virus. I want to thank you for your patience. I want to thank you for your kindness. I want to thank you for all that you do for the residents of our city by supporting each other. I want to thank all of our first responders. I want to give another big shout out to our medical staff and personnel, to our doctors and nurses and janitors and all the folks working on the front lines in our hospitals and our health centers that are doing amazing work. As mayor, I am extremely grateful to represent a city with so many incredible people in there. To the people that last week played golf and soccer, I love you too. And I'm asking you, please don't play golf and soccer this weekend, tomorrow. Let's have a complete day of physical, social isolation so we can turn the corner here. It really is about turning the corner. It's about making sure that we do everything we can to stop the spread of the virus. You can see in the numbers, maybe we can't see in the numbers, but certainly the numbers that we have in Boston would be certainly far higher if people weren't doing all of the things that we've been asking them to do for the last 7 weeks. If we can do this for a few more weeks here, we will get around the curve and we will start to see our life come back the way we all want it to come back. So again, to all of the people of Boston, thank you for the opportunity to serve you as mayor, but thank you for during this very difficult time. I have some questions here from different reporters, and I'll open up to the reporters that are in front of me here. From the Boston Herald, Mayor Walsh, you mentioned this week that you think the stay-at-home order advisory will be extended beyond May 4th. What do you think is a realistic timeline for the beginning to reopen the greater Boston area? And what businesses or services are you hoping to see come back first? I've been talking to the state and the governor quite often, almost every day. My team has been working with them every day. The advisory date is something that I'm assuring. I'm saying the wrong word. I know the governor will be addressing pretty soon. He talked about it a little bit today at his press conference. He's looking at the data like we all are to make sure that we make the right decisions, and I think that that's important to do. As I've said a few times about Boston, I don't think that we're going to be ready to come back for normal business in the city of Boston for quite some time. And certainly I have concerns about May 4th. As always, I hope I'm wrong. But we're still seeing a daily rise in cases and deaths in the city of Boston. We're still seeing a surge, and we haven't reached our peak yet. And right now, our focus is on keeping residents safe and healthy, and we'll continue to take this one day at a time. And I know that when the time's appropriate, the proper decisions will be announced to everyone. Question from WBUR. This is going to be from Marty Martinez. Can you tell me what the plan is moving forward for testing the homeless population and workers? I'm most concerned about details today on how that's happening for shelter workers. Is there a plan yet? Will mass testing happen at different shelters on different days? I kind of addressed it in my remarks, but I'm going to ask Marty to take that question.
Thank you, Mayor. So starting Sunday, we will start to test the rest of our shelter guests, not only in the city shelters that we have, but also the additional shelters that exist in the city of Boston. The additional 1,000 tests that the mayor spoke of that were donated to us allow us to finish the universal testing we want to do for our homeless shelters, and also to be able to test some of the staff that are a part of it. Our staff do important work and are critical to making sure people get the care that they need. So we'll start that on Sunday and plan to try to finish that within 10 days to make sure we can give people the support and care they need from there.
Just a side note, it was not a question asked by the press, but maybe there's the next one, but we're going to do everything we can to try and test as many people in the city of Boston. We're in the process of trying to get access to testing so that we can open it up for all residents. It really is important for us as we think about going back to work, going back to society, having massive testing going on here in the city of Boston, in the Commonwealth, in the country, quite honestly, to be able to gauge that data and that information. Question from Bloomberg. Health experts recommend that testing at least 25% of the city. How much would that cost? Does the city have sufficient funds to cover that? We know that expanding access to testing will help us better understand the true spread of the coronavirus. I don't have a total cost associated with testing at least 25% of our residents, but I will tell you that we're committed to doing so, and we'll make the resources available when needed, working with the state and federal government. So far in Boston, we've tested about 19,000 residents in Boston out of a population of 700,000 people, so there's a lot more work to be done on the testing front. Second question, with the good weather from Bloomberg. With the good weather expected tomorrow, I know you are concerned about having people congregate. Are you taking any new measures in the city tomorrow? The measures that we put in place already are effective ways to slow the spread of the virus. I'll say it again, it's incumbent upon every single person to take it very seriously by staying at home as much as possible. If you go for a walk, keeping 6 feet distance and not gathering when you go for a walk. I know we see our friends and we haven't talked to them in a while, but you know, when 2 people stop to talk, 2 more stop to talk, 4 more stop to talk, and before you know it, there's a group of people standing there talking. Wearing face covering while you're outside your home. We're in the surge, and every single day right now is critical to flatten the curve and saving the lives. With that, I'll open up for questions here.
Mayor, you mentioned the restaurant announcement, and I assume it's effective immediately.
Yeah.
For those restaurant owners, they now have to submit a plan. So how long before you or I walk into a restaurant and actually order or buy groceries from them?
I mean, it'll be turned around quickly. The question is, how long before you can walk into a restaurant and buy groceries? And just to be clear, it's groceries, but it's paper products, and it's meat and some vegetables. You won't be able to go in there and buy what you would buy at a supermarket, but we're going to have a quick turnaround on this. So as soon as we get the first application, the licensing board is going to turn around fairly quickly. I'm expecting they can turn it around probably within the matter of a day, and then the special services will have to check to make sure everything's okay, but it's going to be quick.
Mayor, Senator McConnell has said something this week about cities might be able to go bankrupt. Do I support that? They're struggling financially because of the pandemic.
Yeah, I heard about that. I'm not quite sure of what to make the sense of that statement is. Before the pandemic, we have cities in America that are in tough financial shape and fiscal shape, and the last resort that they want to do is file bankruptcy because a whole new set of guidelines, rules, and regulations come into place, including potentially receivership. I would not suggest any city or state in the country file bankruptcy for the sake of filing bankruptcy. I think it's the United States Senate and the United States Congress's job to work on recovery packages along with states and cities to make responsible decisions. But that's not, in my opinion, that's not the answer that should be given out there. I would hope that the last thing I'd like to witness is cities around Massachusetts or anywhere in this country go bankrupt just to get, you know, for whatever reason Senator McConnell said it. I can tell you one thing, the city of Boston is not going to file for bankruptcy.
Mayor Walsh, it seems pretty inevitable the May 4th reopening is going to happen. That 14-day model that the federal government has laid out, watching cases decrease in 14 days, is that something you sort of follow here in Boston or here in Massachusetts, or would you need more testing, or would you need more?
We had a real deep conversation today. I'm going to have Marty Martinez come up and address this a little bit. We had a real deep conversation about what benchmarks would be in place for us to reopen. But I'm going to let him address it because we're still working through the models.
Yeah, I mean, to the mayor's point, testing is key, right? So in order to understand if you're having any kind of decrease in the number of tests or the number of cases in a city, we have to test more people. And so that's our primary goal, is to do that. But we're looking at clear benchmarks that the mayor will be able to lay out that will show us when we're able to do that legwork. But it's important that we make sure we know the true spread of the virus, which is why we have to test more people.
Mayor, just your reaction to states like Georgia that are reopening already?
The question is my reaction to states like Georgia reopening already. I mean, they're clearly not fully reopening. They're opening certain areas. I can tell you this, if I were going to reopen a state, I would not have chosen the areas, the industries that the governor of Georgia chose. I would have thought about more essential work and what gets our economy moving forward. My concern there, and I haven't spoken to the mayor of Atlanta or Augusta directly, but they're friends, and I've watched their comments. They have major concerns about the surge. They have major concerns about more people being impacted and affected by the coronavirus. They have real concerns about people losing their life. So I don't think necessarily it's the right time now to open up certain industries. I think it's important that conversations happen, and not notifying and not having a full conversation can be dangerous. And I think that I'm hoping they don't regret it. I wouldn't wish anything bad on anybody, particularly around the coronavirus, but I'm expecting at some point in the next week or so he'll be shutting them all down again. Any other questions? All right, everyone, thank you very much. And again, to Commissioner Dempsey, congratulations.